Hello, everyone. Can everyone hear me? I want to welcome you to our hormone webinar tonight. Our goal is that you walk away tonight with some good information. I'm going to introduce our expert here. So tonight's topic is about hormones and bioidentical hormones in particular. And I want to introduce Dr. David. He is a licensed naturopathic physician with over 25 years of clinical experience in hormone optimization, not just balancing hormones, but actually optimizing your hormones, and thyroid care, regenerative medicine, and pain management. He specializes in bioidentical hormones replacement therapy, peptides, which we just had a webinar on peptides, prolotherapy, and advanced endocrine support. His work focuses on restoring function, improving your quality of life, and supporting long term metabolic health through thoughtful, individualized care. And Josh brings a deep clinical lens to complex cases and works closely with the team. And I'm going to introduce our team to ensure treatment plans are safe, effective, and rooted in physiology and not trends. And I'm admitting people into our webinar as we go. So I'm Melissa McLean. I'm board certified in functional nutrition, and I focus on root cause healthcare and metabolic health. I'm a founder of Life Wellness Lab, and my work centers around restoring metabolic health as the foundation for fat loss, body recomposition, hormone balance, energy, and long-term resilience. I use advanced lab testing, and I get to the root cause of your health concerns by these comprehensive lab panels to understand how your body is functioning at a cellular level and why symptoms develop. So that's what I do, and I focus on working with women in perimenopause and menopause. So Sarah is our clinical office manager and patient care coordinator. She is often the first person you will speak to and plays a key role in helping you feel supported. She's amazing, and we're so happy that she's here with us tonight. So now that we've set the introductions out, and I think we have more people coming in. I am going to turn it over to Dr. David, and he will walk you through our clinical side of hormonal care and why bioidentical hormones matter and how they are used safely and thoughtfully in patient care. So take it away, Dr. David.
Thank you so much, Melissa. You are the best.
Thank you. You are.
So, um, I say a lot. I realize that, and I don't think this is. I think I picked a bad day to stop saying it, but I'll work
It's
on it.
okay.
So, okay. So why so many women are afraid of hormones, and we're talking about hormones today. But this really has to do with just overall health. Melissa's, helped countless people with metabolic health, weight loss, um, insulin resistance, diabetes, and so many other conditions. She's just done a great job, and we love to kind of collaborate together, work together, and all of that. So here we go with the hormones. So you know, so many women are told by their either primary care doc or their OBGYN or whoever they read or they saw that hormones cause cancer, may cause, heart attack, stroke, all these things. And they're just there is a lot of confusion still within the medical community with women all over, but it is a big topic because it's becoming very clear that hormones are a critical part of women's health in particular, men's health too, but the focus is going to be more on women's health for this talk. And so there's a lot of fear out there. Um, so one of the reasons why there's so much fear is based on one particular study, and we'll go into that study. We won't go into great detail, but we will mention it, the Women's Health Initiative. So, and the other part of that is that because because of the fear, because of this one particular study was so powerful in the media and the medical community and the drug community and everything, it really has shaped how doctors, you know, medical doctors, people you see on a regular basis, how they view hormones, and it's unclear to them too. I can promise you that. So I've studied with a major medical group called WorldLink Medical. We didn't mention that in the slides, but WorldLink Medical has done an amazing job at kind of clarifying the science and all the accumulation of study around this. Worth mentioning that the FDA has removed the black box warning. This was in October this year. It was a huge kind of milestone for women and doctors and just the whole community revolving around that. So that's impressive and good. So let's move on. So this is the study, the Women's Health Initiative. It was done in the early 2000s. I remember when early in my practice, when there was a big uptick in cancers, a big uptick in cardiovascular accidents. And that was right kind of after I got out of medical school and started practicing. It was just kind of blatant. And a majority of women were being prescribed Prempro. And, I remember even seeing incredible articles in the paper about how Prempro is going to be, so amazing for people, how it's going to be good for their vascular system, their brain, their bones, all these things. And then, they did this big study of thousands of women and clearly showed there was issues, but the study was not analyzed great. It wasn't presented great. And there was a lot of misinterpretation around the study. And so basically what happened is the media got a hold of it, said, oh, actually hormones are bad. And then the doctors who were putting all their patients on Prempro were saying, oh, sorry guys, no more hormones. And that was it. And so thousands, millions, I'm sure, of women just kind of got, okay, no more hormones, good luck. So that's what is in a nutshell. There's a little note down here. Oh, Estrogen Matters by Abram Blooming. Great book. Kind of explains a lot more detail. I often have people go read this book just so they understand kind of the fear and some of the just relative views on why so many people consider, in particular, estrogen dangerous, and it's not. There's a lot of misinformation, and with the women's health, I'll mention one other thing about the study. It wasn't the Premarin, the equine estrogens in the formulation of Prempro that were is bad, that the bad one. Really, it was actually the progestins, the medroxyprogesterone acetate, because we did a lot of analysis of this study through, like I said, major medical courses. And it was that study, or that arm of the study, that really showed that there was issues, in particular women over 65 with vascular accident, heart attack and stroke. So there was a lot of information that came from it, but it wasn't clear cut that don't take hormones because they're going to harm you. Okay. We'll move on from that. So again, I mentioned, well, here's an interesting thing because if you look at the physician's desk reference, and I have to mention this to women a lot. So when they go look things up, they don't get confused. But I mentioned the progestins. And there are, so there's equine estrogens. Those are derived from urine of pregnant mares. And so there's a slew of horse estrogens mixed with estradiol, but the progesterones, the progestins are a chemical version of natural progesterone, and the progestins are also found in birth control. They do have an effective ability to control ovulation and prevent pregnancy, but they are not progesterone. So when you read the PDR, physician's desk reference, it's going to bring all those things together as far as the dangers of progestins mixed with natural progesterone. Unfortunately, that's not the case. And when you look at natural progesterone, it's about the opposite of all the negatives that come out of the chemical medroxyprogesterone acetate, or there's different progestins, but that's one of them. So we mentioned the timing of hormones was ignored. So it's kind of like the idea that has to do more with the idea that a woman should just, okay, wait until menopause and then, or after menopause, and then consider it, whether it's bioidentical hormones or the synthetic versions. But again, that's something else we'll get into. And then of course, metabolic health. We, in the study, a lot of the women actually already had substantial cardiovascular disease. And at 65, there's going to be a higher rate, and they weren't on the right hormones for the right amount of time, essentially. And who knows about lifestyle? Who knows about anything else? All the things that Melissa does for people, those were completely ignored. So what we know, definitely there's a big difference between synthetic hormones and bioidentical hormones. And this is based on many other studies I won't go into, but they are large studies that looked at the effects of just straight estradiol, the effects of straight progesterone, or the combination of the two. There's been a lot from Europe, Asia, and the US, and they're large studies, and they're pretty impressive. They have never shown increased rates of cancer. They've never shown increased rates of vascular accident. In fact, they show the opposite. So big deal. Delivery methods do matter. We'll get into more of that later. We talked a little bit about the timing, and the point of this whole idea is that we need to look at hormones throughout a woman's life rather than just think about, well, menopause, because perimenopause definitely can come into, and it's different for every woman. It's very different, but there's actually early induced menopause, through surgeries, chemotherapy, radiation, and things like that, accidents, surgeries. But all in all, based on a woman's genetics, lifestyle, what she is exposed to in the environment, perimenopause can be a big factor. And there's a big movement right now just to start looking at hormonal health, and I would say for men and women, but it has not been looked at closely at all for women when it should have been. And so starting early and evaluating women's hormone content, women's health, women's overall health, how they're feeling, how they're doing, how that might relate to hormone shifts. I mean, even definitely early as 30 can be a difference in how a woman progresses throughout life. And then,
What?
of course, the metabolic health.
Yeah, Dr. David,
Yeah.
I mean, when we talk about perimenopause, you work with women in their 30s when evaluating their hormones and looking to see even if they can, like fertility as well, right? And if they can carry the baby throughout, they may get pregnant, but you can see all these kinds of things in a 30-year-old or
Right. And that's a great point, Melissa. Because a lot of women, I mean, and it may be an environmental factor. It's That's not very conclusive, but many women deal with what you probably heard of as polycystic ovarian syndrome or PCOS. It's way more common than people think. I mean, more than half of women have a degree of it, some varying degree these days, and that has a lot to do with whether a woman can carry pregnancy, but overall health. Blood sugar regulations are huge. How they feel, how their periods are, anemias from abnormal periods, just debilitating life conditions. So those things definitely should be addressed. And one of the issues is that, so when a younger gal, and she could be in her teens, goes to OBGYN, it's not really, what's either offered is, well, everything looks normal. I guess you're just gonna have to deal with it, or birth control. So birth control is kind of the go-to, and that's fine. It works for some people. There is a downside to that too, and there are definitely risks. The problem with it is there's none of the other options are presented, and so that's I mean, a lot of younger women, even in their teens, like I said, will get on birth control, not to prevent pregnancies per se, but just as a solution to an underlying problem. And the issue is, if you're not addressing the underlying problem at that point, they could be heading right into diabetes, increased rates of cancer, miscarriages, lack of ability to not only conceive but maintain a pregnancy. So, and that's where, like, Melissa and I talk about the importance of just looking at metabolic health for all people much younger, because you kind of want to hit it, or I don't know if that's the best term, but you kind of want to get into it and evaluate it much earlier. And we're hoping, a lot of doctors out there and practitioners really hoping to change things on how we view health throughout life. And instead of just waiting for the bad stuff to happen, but to we have so many markers now that we can look at, so many biomarkers that can really give us hints and show us where someone's heading, including our 14, 15-year-olds, 16-year-olds, and on, or even potentially earlier. But Melissa and I have both experienced that, with our kids, individual kids, personally. So it's definitely a factor.
yeah. I mean, it's happening younger and younger. I mean, right now I'm seeing a 10-year-old, that's having some issues. So, and she hasn't even started her cycle yet. And here she is ready to get into that phase in a few years. So it's really important. And she, potentially has some other root cause issues, but it starts so young. I mean, it's where we live, in this day and age, that we really have to focus in on metabolic health from the very beginning.
Well, right, because the stressors are higher. The exterior environment is just a slew of hormone blockers, disruptors. I mean, whether or
Right.
not you live in the mountains of Japan and only eat out of rock bowls or something, you still get exposed to it. So unfortunately, it does affect all of us, and so we have to know how to manage through the environment we're in.
Yeah. And the nuances around it.
Right. So, what is a hormone? Well, a hormone is a chemical messenger made by a gland or specialized cells in the body that travels through the bloodstream or local tissues to control and coordinate how organs and cells behave. But in simple terms, and I like this, tells your body what to do, when to do it, and how strong to do it. And
Super
I like
simple.
it because it's just to me, it's a strong statement just regarding what these these little molecules are, what they do for us, and how do you overlook that? Because I think if you're lacking, or if there's not a balance, if you're lacking these molecules, it's going to hit you in a lot of different ways, that unfortunately, a lot of physicians don't even necessarily pay attention to. I'll mention, I love the primary care doctors out there. I love the OBGYNs because they do a lot of things that I just don't want to do or care to do. And I did do practice primary care for initially, and I'm glad to be more into these specialty fields. It's a hard role, and so I appreciate them. Unfortunately, the pharmaceutical industry has a big hold on what a lot of our physicians learn in medical school, and they really do not get education in this area, unless they go outside of their original education. And I do attend conferences, seminars, I have for years and years, with a lot of kind of traditionally trained doctors, and traditional fields of doctoring. So a lot of people are getting out and doing that. A lot of physicians, just because it's such a fascinating area and it's got such great results. So just real quick, kind of describe what a hormone does. It travels through the blood, nearby tissue, binds to specific receptors on target cells. And then the target cells change the the activity. So they speed up, they slow down, they grow, they release things, all the kind of bodily functions, throughout our biological beings. So they regulate growth and development, metabolism and energy, blood sugar control, mood and stress response, sexual function and reproduction, sleep wake cycles, inflammation and healing. The examples of some of these hormones are insulin, thyroid, cortisol, estrogen, testosterone, melatonin, and growth hormone. They all play a huge role. I mean, they really kind of define what we are, who we are, how we function, how we think. So they're very much influential on our brains. And I mentioned that down here. So, like, the healthier skin, your muscles, your bones, your cardiovascular structures, hormones manage immune function. One of the things that I see people who get their hormones optimized, they come back and they're like, I just don't get sick anymore. And I hear that all the time, and that can vary from person to person. There's a lot of other factors influencing this for people, but it's a big one because, I mean, a lot of people don't really change much. They just get their hormones optimized. And like, I'm talking, a majority of people come back and tell me that. So obviously they do affect inflammatory processes, which are part of the immune system and also the brain. So when the hormone signaling declines, metabolic health declines, the immune system is greatly downregulated, and the body structures such as muscle, bones, and bones lose health and integrity. So essentially, I talk to people about, when you lose hormones in particular, you become catabolic. Catabolic means your body starts breaking down. You can't keep up with regenerative processes. Anabolic is where the body continues to rebuild, and you can continue to get healthy tissue throughout aging. And that's what we're looking for. We want to keep our joints healthy, our bones healthy, our brains, vascular system. We talk about vascular health, and like a statin is going to keep your vessels healthy and your heart healthy. They don't have anything to do with your vessels and heart. I guarantee you that. And this talk is not about whether statins are good or bad at all,
But
because
they tank our sex hormones as well, and they deplete
oh,
CoQ10, which is important for vascular health and
greatly,
brain. Yeah,
yeah, deplete CoQ10, which the heart it depends on CoQ10.
right.
I
Muscles,
did
tissue.
see,
Yeah.
yeah, everything. I did see a study years ago in a conference that was apparently buried by one of the disgruntled employees of I can't remember who makes Lipitor, but anyways, manufacturer Lipitor, they're one of the first on the block, and they started using and they started because they knew this. These companies, they're not ignorant to any of this. They're PhDs studying all these drugs and the results, but they're very cognizant of the results of what they study. So there's a study, and they started putting CoQ10 in with the Lipitor, and they did a study, see who did better. I don't know I don't remember the details of the study, and it was just a landslide for the CoQ10 arm. And but then they decided, well, that's gonna cut into profits. And so anyone taking a Lipitor or any
Statin.
statin, just make sure you're at least taking CoQ10. I mean,
Yeah.
it's a big deal. All right, so moving right along. So the question why symptoms often come first, and this kind of goes back to even a woman in their 30s who might experience some type of change in their cycle, some type of change in how they're feeling, how they're functioning. This definitely can be an effect of what's going on with their hormone levels. Also, insulin and blood sugar regulation, when that starts getting thrown off, and this is what Melissa deals with on a more intricate level than I do, but it's so important because it's kind of a cascade of events. Hormone shift, you get weight gain, you don't feel as well, you're not functioning as well, and all of a sudden you're not doing some of the things that might be keeping you healthy, some of the things. And so it really is kind of a spiraling event. And again, unfortunately, a lot of these people don't get any kind of direction with it. And,
And they're
that's
confused and they just don't know where to go. That's
right.
what I hear all the time. Yeah.
Right. Again, they might be put on antidepressant, well, you might just be depressed. This has been the kind of story behind women's health for decades and generations. You're either super anxious or depressed, or you're just nuts. And that's just lack of understanding what's going on with these biologic processes in the medical community. They just, when you don't know, you just make it up.
Yeah.
So that's unfortunately what's happened in the past, but it's changing pretty quick.
So these are the kind of symptoms that you were discussing, the belly fat. We have a joint patient that actually, I mean, this is common though, when we see fat, like gaining weight, like 20 pounds in 6 months, 30 pounds in a year, without even changing any kind of things that they used to do. So a lot of people are confused.
Yeah, even starving themselves, at going
Yeah.
to the gym daily,
And
and they still
exercising
have
to
a
intensity, really a lot, and eating less. And that's exactly what your body doesn't need. You need more nutrients and less stress.
right, 100%.
But these are
Yeah,
some of the symptoms that we see that you just explained.
exactly. So yeah, I mean, all these are common. I mean, they for so many women. I mean,
Yeah.
and not even in perimenopause or menopause, but even earlier. Like I said, in their teens, it
Yeah.
could be just from dysregulation. So there is a place for using bioidentical hormones for even younger women. So we're getting away with the idea that, oh, this is only a menopausal thing. And it is a perimenopausal thing. And it is, for a woman in puberty. I mean, these things have a
Yeah.
role.
Yeah.
So my OBGYN said everything was normal.
I mean, you can put in the chat too if this you feel that this is something that your doctor has said, your OBGYN said, oh, your labs are fine, but yet you feel terrible. If you feel
Well,
like
right.
putting
And,
in the
and
chat.
I mean, one thing is it is hard to test some of the sex hormones when you're having a cycle because they fluctuate. They if everything looks good, you know, they have this kind of easy monthly kind of cycle where, you know, estrogen, progesterone goes up, you know, there's a follicular phase, ovulation, and then it goes down, and then you have your period. Um, and you can test for that, but most of these things are based on symptoms. But the issue is you have to understand the correlation to a person's symptoms and their potential condition rather than just looking at labs. So, and that's also very true with thyroid, not just the sex hormones, because TSH, which is a common test to look to see if your thyroid gland is making too much thyroid or making too little thyroid. TSH is often just completely normal. And if it is, most often, even the endocrinologists who are the hormone, you know, endocrine specialists, they don't do much with it. If it's normal, they say, well, it's normal. And then at that point, you're offered antidepressants, anxiolytics, you know, more drugs. And so it's just not getting to that root cause. And that's really what it comes down to. And I think this day and age, we have the ability and the knowledge, technology, the studies, the everything to get to the root cause. What's actually happening? You know, estrogen signaling can change big time. Progesterone signaling, worsening insulin sensitivity. That's a huge one with people with PCOS. They will have insulin and blood sugar regulation problems along with fertility issues, but also cancer rates go up by 50%. Vascular disease goes up, and it's because of all these things. They're a good example of what we're trying to avoid throughout life. And it really does, there's not a drug for it. There's the hormones. So when a woman does lose estrogen, but not just estrogen, testosterone or the thyroid is not optimal. It may be normal, but it's not optimal. Insulin sensitivity will go down. It's interesting with testosterone for both men and women. When I give people testosterone that are type 1 diabetics, so they're insulin dependent, their pancreas cells do not produce insulin. They give themselves shots daily when they ingest food. I have to tell them they may need to go to their endocrinologist and adjust the insulin dosing because it automatically tends to improve the cell sensitivity, just testosterone. But estrogen has that effect as well. So, you know, this is what we're hoping to do is, you know, really look at the root cause and get a metabolic and hormone evaluation, not based just on labs, but we use a lot of labs. Melissa uses and orders a ton of labs, more than I do, when it comes to biomarkers and and just metabolic markers that she's great at reading, and she can intervene and help change those through support. So it's part of that liver and gut clearance, but stabilizing blood sugars is just key to everything. And it's not just an easy thing. You do have to have someone guide you through it. And then of course, you know, looking at the hormones is, you know, a useful tool.
For sure.
So you know, I like this statement because this is what you hear when people come to you. The most common statement that doctors hear, all doctors that have women and men, well, to feel like myself again. But the most common statement is, "I don't feel like myself. I
When
do
they
not
come to
feel."
us, yeah.
When they come to us, or they go to their primary care doctor or their OBGYN, they just do not feel like themselves. It's like such a shift that you don't even, it's like they're jumping out of their skin. And one of the common, you know, I'm a man, but I have been around and treated a lot of women. So one of the common things is that there's a big, not only lack of energy, anger, and all this stuff, but there's a point of almost rage, and they hold it really good, meaning they're not necessarily letting it out. Maybe sometimes they are, but it's a big sign. And most of that, you think of it's almost psychiatric, but it really actually comes down to the hormone cycle and what's going on hormonally. And so all of a sudden they're like, I feel like myself again. They
Right.
don't have that. And
Yeah,
their
that's what I
energy
tell.
returns.
Yeah.
What's that?
Sorry, that's what I tell my clients about, that it's not their fault that they feel these, like, I mean, unless they're angry legitimately, but like the
Well, right.
rage,
Exactly. And
is usually,
and there's no reason. Like, I mean, you can have rage if someone does something to you directly and you're like pissed off about it. That's makes sense. But for it to just come out of the blue, it's hormonal.
yeah,
It's
it's biochemical.
and then you begin to wonder how many psychiatric conditions are just linked back to all this. But but yeah, sleep improvement, belly fat, the accumulation that can be managed, and anxiety is huge.
Yeah.
So, just a little brief summary about perimenopause. Perimenopause is just the major hormonal shifts that a woman experiences before menopause. And it's, like I said, it's really different from one person to the next. There is a lot of similarities sometimes in, what happened to mom, what happened to my sister, they're so genetic kind of similarities, but not always. Not It's very different from one person to the other. And so perimenopause, though, are distinct hormonal shifts, and that's why it's good to test a lot of stuff early. And definitely can start in your 30s and 40s and continue well into your 50s. And a lot of people, I mean, women could hit menopause. Early menopause is like 45, and it's not uncommon, but that is considered like early menopause. But there's a lot of women who don't hit menopause until their late 50s, and they might have had perimenopause, but perimenopause is one of those things that could go on for for a long time, maybe not decades, but at least 10 years,
Right.
maybe more.
But it's not too late to start bioidentical hormones either.
And actually, it's really never too late. There's this idea like, okay, well, I didn't take them. I'm in menopause. I'm 75 years old. I've treated a lot of women in their 70s and even 80s, and up through their 90s. But I've had women in their 80s come to me, and I still start them, and they love it. And it's like they do feel better, but they're also still protecting their brain and their bones and their joints, and they have less pain. It's Yeah, I would say that it's not never too late, like at
It's
all.
never too late. So I just want to keep track of time here. We're scheduled to do a Q&A in about 10 minutes or so. So we'll
Sure.
get through these slides. And what we'd like you to do is that if you have any questions, which I start seeing in the chat that there are questions and we want to get to as many as we can, put them in the chat right now and we'll be able to have about 10 minutes or so for a Q&A at the end. So let's just, if we can, just because we have a little bit more to go
Yeah, I
through.
mean we've covered a lot already. These are just things we've already kind of gone into.
We talked about that. Hormones and metabolic health are
Yeah.
all linked. I mean, when people come and see Dr. David and I, it's really transformational. Um, so let me just go through some of these. So why people call this magic is that the bodies respond again. They stop fighting physiology and the constant strain um, that they feel, or the struggle that they feel. Like you get to sleep better. You start to get into that metabolic state, and it's just a really wonderful tool to add. And I know that Dr.
Right.
David, you can see, you do free consult to see if bioidentical hormones is right for people.
Right. Yeah.
Um,
The other thing is, we talked about one major symptom for women, but and this is for men and women that comes up a lot, but the anxiety around these hormonal shifts, like anxiety is a huge one. And a lot of that can disrupt the sleep wake cycle by a lot. Um, one thing I want to mention, anyways, let me finish my sentence. So anxiety and it's more of the stress, how people handle the stressors, because stress never goes away, just never. Every day is going to be a stress in one way or another, but how people handle stressors just completely shifts. Um, the delivery method, I do not use shots for women. I do with men, but none of the deliveries I use with women. In fact, the majority of it is actually just oral capsules. But I'll go into that
Yeah, that would be
later.
good. So, what it's not. Let me just go through this.
Right.
So, these are the kinds of things that we talked about earlier is that when we are just not only metabolically healthy, but we add bioidentical hormones to optimize to your personal care, you have greater brain protection, bone and muscle preservation, and it's incredibly important to keep our muscles and bone really strong and lean and not losing it. Our muscles, it's our longevity organ, cardiovascular and metabolic resilience, and quality of life. Um,
Yeah,
so let me just,
one thing with estradiol in particular, as far as all the education I have at this point, there's nothing that has been pinpointed as more protective to your brain and preventing beta amyloid plaquing and bone or brain degeneration more than estradiol in both men and women. It's huge.
yes, yes. So let me just go into, so here we are. So I think we have, hang on one second. I'm just going to see what else is here. We're going to do what we see every day. Your body is always communicating. Sorry for this, you guys. So why don't we open it up to Q&A right now? Does that sound good?
That sounds great.
Okay. So I'm going to stop sharing my screen here. Again, thank you all for joining us. And this is going to be recorded, and so you have access to it. So let me just
Yeah,
go
and one
through
thing
a
one
few.
thing I'll say is that anyone who wants to schedule time with me to just have a free consultation, if questions come up they aren't answered here, obviously, just call Sarah. We can do a quick free consultation, and any questions can be answered.
Yeah, Sarah can put that in her calendar link in um, the chat here, and you guys can just book a call. I mean, what I always tell my clients is when talking to another practitioner that you have to feel good, right? And you can bring all your questions to Dr. David about all that you've heard, what you're on, what you're considering, and he will kind of shed clarity on what is the best approach for you. And it is definitely individual. So let's get into some of these questions. Okay. Sorry, I'm just going to look through here. So Darcy asked if Meno is not the time to start and you are already in Meno, then what is the person to do? So I think what she is saying is that you're talking about Darcy bioidentical hormones, right? Um, so I think we talked about that a bit. That there's always a time. I mean, there's
Oh, you mean it's starting in menopause? What, you're already in menopause?
yeah. I
Yeah,
think that's
you
what she.
absolutely. It's in fact that's when most women do start. But I think because of the not the the novelties of the knowledge that we have now, there is advantages to starting looking at this and treating people earlier before menopause. But if you're already in menopause, that's not a problem. It's definitely worth starting.
Yes, 100%. Diane asked, how are hormones affecting leaky gut symptoms, inflammation, reaction to grains, beans, dairy, eggs, undigested food, and stools? Um, this is where I focus in on a lot of, but we have peptides that do that too. But wouldn't you say that the neurotransmitter are in our gut, right? And we need to make sure that we have enough nutrients like good vitamin D and um, you know, dysbiosis in the gut, which is really important for our hormones to work properly.
Well, I mean, the way I look at it is you want the hormones to make everything else work properly because when you're void of the hormones, like I said in the beginning, you become more catabolic. So that includes your gut, that includes your all the vessels in your heart and your body, your brain. You have you see it in your skin because that's in the outside of us, but this is all happening in our organs inside of us. So the hormones are part of what keeps all that tissue in place. I mean, without it breaking down, we talk about vaginal atrophy and dryness. That's a breakdown of tissue that's still actually happening in your body, not just there. But the hormones are very responsible for that. Every bit of your tissue, not just what you see. Collagen is the main issue here. You need collagen. You need the proteins production that and the collagen production for all those structures to be healthy.
Yeah.
And then what you do, Melissa, is make all that happen.
Yeah. Well, Diane, if you want a free consult, go to Sarah and she can kind of navigate which is the best option because if you are inflammatory and you feel a reaction to grains, beans, or dairy, and you have undigested food in your stool, that is something that we have to take care of. So it's, and then getting you really your health, your gut optimized and understanding what those mechanisms mean, and then we can go from there. But go ahead and book a call with Sarah. Okay, Chris asked, I've heard bone density versus bone quality, meaning if I have low density but high bone quality, I'm not susceptible to bone breaks. How do I test for bone quality and what is the safest natural treatment?
Well, so like estradiol, testosterone, vitamin D, those are all very important in bone remineralization and it's the bone mineralization that creates bone health. The issue with the bisphosphonates and the drugs is it looks like they're more solid on a DEXA scan, and but the actual, and this is a good point, great point. The actual health of the bone has not really improved. So fracture, we're just trying to prevent fractures. Is basically it. And fractures are still incredibly likely amongst all these kind of horrific side effects that they can have with many structures, including your jaw. A lot of dental surgeons will tell you they can't even do surgery on people on the bisphosphonates, which is a great example of that. They'll just disintegrate. Your jaw will disintegrate, and it's a tough one to test for. There is actually a test, and I don't remember the name of it, but you can. I wish I did. I got to look it back up. It tracks through blood what's being excreted from the bones or not. So you can follow it along and say, oh, it's not excreting the minerals that are coming from the bones. It's actually blood, and I think there's a urine test. I never do it, but I know about it, and it would be a good one. I wish I was more in tune with that one, but there is ways of testing your progress and what you're losing as far as bone density. It's hard to test your actual bone mineralization unless you did like a surgical biopsy or something.
I hope that answered that. And then let's see. Someone just says they have to leave, but good information. And then Judy Young, who is our joint patient, says Dr. David and Melissa started treating me at age 75, 76. It really helped my inflammation, RA, bone health, energy, sleep, metabolic health, and emotional regulation. My doctors are amazed that I'm no longer having RA symptoms. Thank you both, and Sarah too. That's what we like to see. So
So glad to
wonderful.
hear that.
Love Judy. So Diane, how do you schedule a consult with Dr. David? You can get on Sarah's calendar, and she does all the scheduling for Dr. David.
Do
So there's
we
a
have
link
the
there.
clinic number somewhere?
Oh yeah, if you want to call as well.
Some people just like calling. I think
Yeah, no problem.
I'm one of those people.
So thank you for joining us, all of you. We're going to have this recording available, and if you have any questions, please give us a call. We're here to help. We really do care about our patients and our clients, and we're just so grateful that you joined us tonight. Thank you, Josh. Thank you, Sarah. We're just so happy to be together tonight.
Thank you, Melissa. You're wonderful. Thank
Thank
you,
you.
Sarah.
Thank you, Dr. David and Melissa, and thank you everyone for being here. Book a call.
Bye.
Bye bye.